Mega Shrivastava. I'm a preventive medicine resident at Mount Sinai. We're going to talk about some basics about diabetes. So essentially like what it is, and then like go into some of the treatments options. So what is diabetes? So it's a chronic disease that occurs when the body doesn't produce enough insulin or can't use insulin properly. So essentially it's really that your body is having difficulty moving glucose from your blood into your cells. And before I started medicine, I didn't fully understand that blood is just like a road pathway that has a bunch of stuff in it that's delivering things to your cells in your body. So in type 2 diabetes, that's the more common one. And type 1 diabetes is often diagnosed very early on when you're younger. A lot of what I'm going to be talking about is more catered towards type 2 diabetes, but they're very similar. And type 2 diabetes can kind of mimic type 1 diabetes a little bit, which I'll explain. So type 2 diabetes is that your body, it makes insulin. Insulin is the hormone, it's the like protein that helps your cells take up glucose. Your body needs insulin to be able to get that glucose and to get it out of that blood so you're not hyperglycemic. So in type 2 diabetes, your cells are not taking up that insulin. Usually it's because they've been exposed to a lot of glucose in the blood and insulin as well and are resistant to the insulin. So the cells are like, I don't want insulin. I can't really bind insulin because I've been seeing too much of this and I don't want to take it up. It's the issue of the cells themselves in the body not taking up that insulin and therefore not taking up that glucose from the blood. And so you end up with a lot more glucose in the blood. Type 1 diabetes is different. It's when the cells in the pancreas that produces insulin are destroyed. So the body's not even producing insulin in the first place. You have insulin in type 2 diabetes, but your receptors in your cells in the body are not taking it up from the blood. And so you end up with a lot more glucose just hanging out in the blood. Whereas in type 1 diabetes, you don't have insulin even in the first place. And type 2 diabetes, if you go on untreated, sometimes you can get this destruction of the cells in the pancreas, or like the pancreas just stops producing insulin because they're like, it's kind of useless because the cells aren't taking it up. There's just like a lot of insulin. And when there's a lot of insulin in the blood, it tells the pancreas that there's a lot of insulin and that we don't need insulin production. And then the cells in the pancreas that produce the insulin and can get actually destroyed because they're not really being used when it's type 2 diabetes is like really progressed. That's also why at that point, people will need actual insulin injected. That's sometimes a confusion of if you're type 2 diabetes, you're technically producing insulin. So why would I need insulin? But at a certain point, you actually have less insulin as your body gets more and more insulin, as well as glucose in the bloodstream. That affects the pancreas and its ability to produce the insulin because it's being told that, oh, there's already enough insulin in the body. That's why at a certain point, for a lot of people that live with diabetes, they will need some insulin injections as well because their body's not producing enough insulin. But the main way nowadays of diagnosing and sometimes screening as well for diabetes is the hemoglobin A1C test. This is the best test because it measures your glucose levels, not just from that day, like the fasting blood sugar test does, but from the course of like 2 to 3 months. So it's kind of the way to see how your glucose levels have been over the past 3 months. To get diagnosed with it, the actual levels are 6.5% or above, depending on how you're diagnosed or like what your A1C is. So if it's like your A1C is like 9 or 10, your goal is not necessarily to get to 6.5 again, it's to get to 7%. Diabetes is this tricky balance sometimes, especially once it's diagnosed and giving medication, of making sure your body gets their glucose levels under control. So there's less glucose in the blood, there's more glucose getting taken up by your cells, but also making sure that we don't get you to a place that's low glucose because that's also dangerous. Sometimes that tight control of being, we want you back to 6.5, that's actually not really something we want. And overall, it's really just the goal, even just small decreases in your A1C over time can be hugely impactful. For blood sugar tests, that's also kind of similar. You want to have some goals of where your blood sugar should be, but we don't want it to be so tight if you already have diabetes. But basically for the blood sugar test, so this is just testing what your sugar is at that moment. For diabetes to be diagnosed, that blood sugar test, when you haven't eaten, which means that there'll be less glucose in our blood, it would be 126 or above would make us suspicious of diabetes. And then for pre-diabetes, this is pre-diabetes for type 2 diabetes. So we're seeing that you actually have higher levels than normal of sugar in your blood, but not quite to the level that makes us think that you have diabetes just yet. So it's like middle range of being pre-diabetic. So you are still having some insulin resistance, some glucose resistance in your cells, but not to the total point that is causing higher levels in the blood. That's really concerning, but it's mildly higher levels of blood than normal. That would be like a 5.7 to 6.4%. So that, and then for prediabetes, for the fasting blood glucose level, you'll see a little bit less than 126, but over 100. And that's kind of changed because for prediabetes, some of those diagnoses were different and people were diagnosing prediabetes as diabetes. When you're at the point of diabetes, it's telling us your cells are really struggling to uptake that glucose. You will need some medication to help with that. For prediabetes, your cells are struggling, but we can still try to prevent this and get them adjusted so that they're taking up insulin again. And we really want to do that with just diet and exercise. For diabetes, diet and exercise is extremely important because those medications won't work as well if you're still overloading with glucose, those cells in your bloodstream. So diet and exercise is important across the board. But for prediabetes, it's really like pre-medication, like medication probably won't really help you just yet because you're still responding to insulin and glucose, but we want you to get to a place where your cells get less overloaded with glucose and really just focus on diet and exercise. For the normal rates, you want A1C should be below 5.7%, and then your fasting sugar test would be less than 100. That's for people that don't have a diagnosis of diabetes. For some of the measurements that you take if you're diagnosed with diabetes, we don't necessarily need this like tight goal if you're like already taking insulin for your fasting blood sugar test to always be less than 100. But that depends on the person and it depends on how progressed your diabetes is. And that's something that's more individualized depending on like what your doctor has seen with all of your trends in the past and what your glucose goals should be. The glucose tolerance test is not really done very frequently anymore unless you're pregnant. For pregnancy, they will always do a glucose tolerance test. This is basically like drinking a bit of sugary drink that's given in the clinic and then seeing how your body responds to that intake of sugar and what the rates are in your blood. For diabetes, after you take that sugary drink, it would be like 200 or above and to be diagnosed with diabetes. And then pre-diabetes, it's like 140 to 200. And the normal rate for your body to be responding to that influx of glucose is 140. These are all ways to diagnose diabetes. So not for monitoring. You do a fasting blood sugar test sometimes for monitoring if you're on insulin, but these are just how you would diagnose it. What your goals should be for the blood sugar test, especially if you're on insulin and monitoring this. And not everyone needs to be monitoring their blood sugar levels every day. This, again, depends on what level you have of diabetes and what your doctor has told you. But for fasting, less than 100 for your fasting blood sugar is normal for someone without diabetes. For someone with diabetes, the goal is less than 130. This is because we don't want you getting to a place of having too little of glucose in your blood. It's really a balance. That's kind of why there's not this tight goal of being like, we want you less than 100 when you wake up. We really want it to be less than 130 is the ideal. So 80 to 130. And you'll notice the lower number for diabetes is still a little bit higher than what you would see with a person without diabetes. And then after eating, your glucose levels are going to go up. Even without diabetes, you see it go. The goal is really to be less than 140. For someone with diabetes, the goal 2 hours after a meal. So this is after you've digested a little bit and now the glucose is in your bloodstream more. That goal is less than 180. Then your A1C, it's less of this tight goal of knowing the normal is 5.7% or less. We don't want people that have diabetes to have that goal. The goal is really 7% or less. And then you're in a healthy place that we've seen in the medical data to have this less strict hemoglobin A1C. So under 7% is really the goal, especially if you're starting at higher numbers for your A1C. Even just getting down a few points can make huge differences in your life. So don't be discouraged if this feels like a far away number for you, because even getting a little bit less of your percentage of your A1C is hugely beneficial for your health and for your mortality. What are the risk factors for type 2 diabetes and how is it caused? So it's actually a genetic component. They actually say it even has more of a genetic component than type 1 diabetes, which is very interesting. Some of it is out of our control, but then there are a lot of things that put people at higher risk for type 2 diabetes. So definitely unhealthy diet, lack of exercise, obesity. These are all all things that are modifiable risk factors is what we say. It puts a little bit more glucose into your blood. Anything that puts more glucose in your blood, that's hugely from just diet itself. And then lack of exercise, your cells are not taking as much glucose because they aren't really exercising as much. The more you exercise, the more your cells need more glucose because it's like feeding mechanism. That's how it gets its energy. When there's not that much need for the cells to be uptaking that glucose, then it's going to stay in the blood. Depression is an actually interesting one. It's really related to dopamine levels. Decreased dopamine can also cause high levels of the glucose in the blood. And that's really just through the mechanisms of dopamine influencing just how cells will uptake the glucose as well. And then gestational diabetes, being pregnant puts you at risk of diabetes as well. If you've been diagnosed with that, it gives you an increased risk like long term for type 2 diabetes. That's something that after you give birth, you monitor as well. Type 2 diabetes in the family, so this is the genetic component. And then old age, there is some evidence of just as you get older, your body cells just become a little bit more resistant to glucose. They're just like not functioning in exactly the same way as before. So as you get older, it does increase that risk. And then high blood pressure also, basically having high blood pressure and the way that it kind of puts pressure on the cells in the blood vessel kind of affects that uptake and the exposure of glucose and insulin to your body cells. And then smoking and drinking alcohol, that also increases risk. And a lot of it is similar, like vessel related impact on how your blood is taking up glucose. And same with fatty liver. And then medications for hormonal diseases can also impact how your blood is taking that up, and then increased lipid levels. A lot of things can contribute to you having high glucose in your blood. So some of it is the impaired insulin secretion. Your cells are just not taking it up. So it's just leaving glucose in the blood. There's less insulin to take up the glucose. And then insulin resistance, your cells in your body are not taking up that insulin as well. Decreased dopamine that influences the taking up of the blood as well. And increased glucose reabsorption. So in the kidneys where we produce urine and excrete a lot of important toxins and things that are not needed from the blood, sometimes the kidneys, and this can also be affected by hypertension, they actually take up too much glucose in the kidney. So then you end up with more glucose in the blood. And then incretin deficiency and resistance, this is a different hormone, but it's essentially a hormone related to eating that can also give you high levels of glucose in the blood. And then increased glucose production from your liver. So the fatty liver does this too, because it's like being told that it has enough of these carbohydrates and fat in the liver that it increases glucose in that way. And glucagon is another hormone that's produced by the liver that is meant to use glucose and use that for storage and help that get stored. So increased secretion of that can cause high levels of glucose as well. And then lipolysis is basically cutting down fat cells. When your body is trying to break down fat, the fat breaks down into glucose, and that could cause hyperglycemia. For prediabetes, you see this like start of the insulin resistance and a little bit of impaired insulin secretion, as well as some of the glucagon secretion and lipolysis, and then a little bit of the incretin deficiency as well. Oftentimes, the most common symptom is not having any symptoms initially. And once you're at the point that you are getting symptoms, it's actually quite concerning because that is telling us that your body is quite hyperglycemic, most likely. So this is also why getting screened for diabetes earlier on is also important. Sometimes it's really variable depending on the doctor in terms of screening, because the actual guidelines don't actually say to screen until you're like 35 officially. So it's really up to clinician judgment. But since we're seeing so much diabetes, most physicians will screen a lot earlier than that. So it's most common to not have symptoms, but some of the symptoms that you can see with diabetes, and especially as it gets more advanced, is frequent urination, being really thirsty all the time, being very hungry, seeing a sudden drop in your weight. This often happens if you're becoming really insulin resistant, or if you have type 1 diabetes, you can see a lot of weight drop. And then type 2 diabetes, you can see a lot of weight gain. Your body's cells aren't getting the glucose it needs, so their healing properties are not as good. So the wounds won't heal as well. You can also see some tingling in your hands or feet. Neuropathy is what it's called. Your nerves get affected by diabetes. And there's also dizziness and irritability and blurred vision. So the vessels in your eyes can be affected as well. A lot of the dizziness can sometimes happen from having too much glucose in your blood, and also can sometimes happen from having too little of glucose in your blood. That's always an important thing to evaluate. And then irritability, because your cells aren't getting what they need and your body's not getting what they need, because it's really connected to dopamine as well. It can really affect your mood as well. So the mainstays of how we treat diabetes, how we prevent it, how we need to be aware of even when you're taking medications or insulin, is what you're eating, what you're putting into your body, what you're doing with your cells in terms of like exercise and stuff. Hugely important is eating a healthy diet and doing some exercise. Everyone always says this. Things that I always emphasize with my patients is just making small achievable goals. Like, my diet is not perfect. I have exercise goals that I have not met yet. We're all on a trajectory of wanting to improve our lives and our health and our bodies. So being patient with yourself while also challenging yourself a little bit in a good way and in a way that works right for you, of getting yourself to your goals, but not doing these like big things of being like, I am not going to eat any carbs week at all. I mean, like, go for it if you're super motivated about it. Do something that's feasible, like something small. That really is something only you will know. But at weekly goals is always good. So in terms of eating healthy, we know that we want half the plate to be vegetables, and then trying to have our carbs be whole grain carbs, trying to keep things as colorful as possible, and then eating some healthy fats, eating lean meats, avoiding red meats. If there's like one thing that you can try to do, portion control is huge. So trying to make sure you're not eating more than like a cup or two of carbs each meal, and then trying not to eat too much of one type of food. So trying to diversify your plate. We know there's so many limitations. It's so expensive to get really good food and healthy food, especially in this area. There's sometimes free kitchens. So try to be aware of things that are happening in your community, and then spacing your meals evenly throughout the day. So people say small, frequent meals. You can do breakfast, lunch, and dinner, and just making sure that they're spaced. You want to give your body some time to actually process that glucose and do stuff with that glucose. So this is also why a lot of people are always like, make sure you eat breakfast, because you have a whole day to then use that energy. And that's the reasoning behind it, because then you have your whole day to actually use it. So that can really help your body and your glucose levels. And then avoiding skipping meals. So making sure you're still eating. It's really important to try to get to a diet where we're eating, your body still needs that glucose. Everything in diabetes is a balance. So you don't want like completely fasting. Obviously, you're going to be fasting overnight because you're not really moving overnight, can have time to digest after dinner, and has glucose throughout the night. You don't want to be skipping meals. Trying to keep half your plate vegetables, a quarter with whole grain or starchy vegetables. Starchy vegetables, they're not all built the same. So things like sweet potatoes, a little bit better than potato, and then doing like a lean protein like fish or chicken. And then if you're vegetarian, like something that's both like a carb and then also has protein is also good. You don't always need milk. They say that this is not quite as necessary, but if you do drink milk, having skim or 1% milk, doing one of the lower fat milks. We used to say you should have half your plate fruits and vegetables. We really are trying to have people not eat less fruit necessarily, because fruit is still better than a lot of like processed foods. But in terms of actually health benefit, we see that vegetables can help you a lot more. It gives you so many more vitamins and nutrients, and especially for diabetes, fruit has a lot of glucose, so it's still sugary. So just being aware of that, that doesn't mean you need to avoid fruit. Fruit still has benefits and is better than eating a candy, and it has like a lot of vitamins and nutrients as well. But in terms of glucose, it's still, that's a huge thing. We're trying to be aware of how much glucose we're taking in, especially in diabetes. So trying to be wary of how much fruit you're taking and really emphasizing vegetables. Vegetables are always hard, because I think this goes back to how things can be a little bit expensive or a lot of bit expensive. So finding that's always a challenge. Even like frozen vegetables and canned vegetables. I would say frozen vegetables are better than canned vegetables, because oftentimes canned vegetables can have some things added to it and sodium, and we know hypertension can be connected with type 2 diabetes. So just being aware of that. And then just remembering to avoid processed foods. And when I'm saying avoid things, this isn't to say like never in your life. It's just to say just a little bit less than what your normal is. And this is really just to get us thinking about what is unprocessed and what is processed. So this isn't necessarily like everything processed is the worst and bad. Like a lot of whole wheat bread can be healthy, but to be aware of how much your food is getting processed and to try to prioritize. We want these like fresh things that are not processed. Nuts is a thing that can really help with protein and help with diabetes as well. And the fruits and vegetables and having milk and eggs and meat. And milk, I would say it's technically processed too, because we like pasteurize it in this country and stuff. So it's technically processed, but it's still a food that we need. We often say processed as in we think chips and Cheetos and things that are like ultra processed, but it's good to just think about like a lot of things are processed like a little bit, and even like things that are pretty reasonable and healthy. These are not things you need to be avoiding completely for oils and butter because they're fat to try to decrease a little bit. But processed doesn't always mean it's the worst thing ever, but thinking about how processed it is, what is actually in that food, and how it's going to actually impact your health. So we already know bacon and ham are very processed, and then they also are red meats and just have a lot of heart risk because of that. So trying to avoid that, like even doing processed turkey is a little bit better, but turkey still, because it is processed deli meat, there's a lot of salt in it. So just being aware of that. And then the ultra processed things like cakes, chips, cookies, and candies, those are really ultra processed, very universally unhealthy that we want to avoid. Avoid in terms of like, don't eat these things every day, but it's okay in special occasions. We're all humans, being forgiving of that, but also being realistic about what your body needs and what's right for your body and having goals for that. And then definitely getting active. This is how your body takes up the glucose, doing some level of physical activity. And there's actually data that even doing a small amount more a week can have huge benefits for your health. There's goals of doing at least 3 days a week of some exercise, but even if you do a small amount more, you'll see that actually will help you. You may not see like huge benefits just from walking another 10 minutes or something. You may not see that like right away in terms of like your breathing and what you're feeling, but in terms of the long term, even just a little bit of that increase in exercise can actually help you a lot, because even just that little exposure that your cells are having to using more glucose and actually getting moving and mobilizing and can really be helpful. So physical activity, it can give you more energy, it can relieve stress, gets your joints more flexible, it lowers your risk of heart disease and stroke, and improve your diabetes as well. In terms of when you think of moderate exercise versus intensive exercise, moderate exercise is when you're not really able to talk too much, like you're able to say a few words or say some things but not talk too much. And more intensive exercises when you can say very minimal words. So moderate exercise, you can't really chat, but you may be able to say a few sentences while you're working out. And intensive exercises, you can just get out a few words, but you're kind of huffing and puffing a little bit. And both of those are the goals. We want you to do some amount of that type of moderate or intensive exercise during the week, but even doing some lower exercise can still be beneficial. So just doing something to get active. And that's really based on what is feasible for you and what your goals are. So in terms of medications, this is basically to say that because there's so many ways that your blood can get high glucose, there's a lot of medications because they're targeting different ways that your blood gets that high glucose. There's metformin, there's GLP-1s that are also used a lot. They're also used for weight loss now as well. But essentially, they're trying to tell your cells different signals to try to take up more insulin or take up glucose. They try to increase glucose getting pushed out in the kidneys. So there's many different ways that medications target the diabetes and try to shaft the glucose out of your body or into your cells. And then in terms of insulin, so there's many different types of insulin. There's the rapid acting, then there's short acting. So the rapid acting is like Novolog, and short acting, and then there's intermediate acting and long acting. This is really to show you that there are many different types of insulins. And in terms of just finding the right regimen of insulin for you, if you require insulin, this is only when you're at the point where your diabetes is so advanced that your pancreas isn't producing enough insulin itself. So you need some of that extra insulin for your cells to take in that glucose. So this is really a balance. And this is also when you're going to probably start actually checking your glucose levels more and seeing when your glucose is getting really high, when you need that insulin to help it take up into the cells. Some people will just need this long acting insulin. Some people just have a peak in the morning and they're fine the rest of the day. That's kind of rare, but sometimes people will just need like one short acting at one time. Sometimes people will need the long acting and then also a little bit of short acting throughout the day whenever they eat. It's very variable. And a lot of times, because insulin is a separate thing from how these medications are and how they're targeting your diabetes and helping your cells or taking that glucose or get rid of the glucose, oftentimes you may be combining both of those. Sometimes at a certain point, some of these medications may not be helpful for you and it's just insulin that can help you. That's really dependent on your doctor and what they've seen for you and what will make sense for your regimen. So insulin, there's different types in how they work and how they affect your glucose and what they do. So you give your body the long-acting one, you'll give your body like a certain amount of that type of insulin, and then it'll take some time to work and will actually last throughout the day, staying in your blood and being that transporter for glucose into your blood. Whereas the short acting will just last for a little bit that you take typically before meals. And then as you eat, it'll be in your blood to take in that glucose, but then it won't last for the rest of the day. Then in terms of things that can happen from type 2 diabetes and why we care about it, why we want to avoid things, it can increase risk of cardiovascular disease that can cause heart attack and stroke, and then peripheral vascular disease. So it can really affect your circulation in your arms and your legs a lot as well. If uncontrolled, can be debilitating, can really affect the skin around that area, your feeling around your legs, your ability to walk. This is also related to some of the other vascular complications that happen in the smaller vasculature. So oftentimes people will not be able to feel as well, and that's how you get some ulcers or some pain, because you might have stepped on something and you really don't notice for a while because you really can't feel the bottom of your feet. And then diabetic nephropathy, circulation, and that high glucose level can really affect your kidneys function as well and cause problems with the kidney. And then the small vessels in your eyes can also be affected by the glucose levels, and that can cause your eyesight to be affected, which is the cause of some of the symptoms that people have of blurry vision. So this doesn't happen to everyone in terms of feeling all of these things, but it can happen. And this is also why it's important to see your doctor and to get screened for things. We always check people for neuropathy. If you are diagnosed with diabetes, you should be getting an eye test every year. And then your kidney levels are monitored by your doctor as well. They will check labs for that. We can see how your kidney's functioning. This is why we care about type 2 diabetes and why we want to get it under control with all these things, with diet and exercise, with taking your medications, being on top of it. You can really minimize your risk of these complications so much. But a huge part of it, like a lot of things in medicine, is really monitoring, detecting things early, checking the kidneys, checking your eyes every year. Even if things feel great, you really want to be on top of actually checking those things and making those positive changes. And we want these changes to be sustainable when it comes to like diet and exercise. So doing things that are very feasible and not pushing yourself so much, being accepting. We are all limited in what we can do and how we can change things for the better. You can't change everything overnight. So just being patient with yourself, but being motivated enough to be like, this is a priority in my life, and I do want to avoid some of these risks. And then basing your goals off of that. Just like how diabetes is a balance of making sure you don't have too much glucose or too little glucose in your blood. This is also how life is in general. We're all about balance and doing what's right for your body and for your trajectory in your life and trying to do things in a very sustainable way.